The information presented in this program should not replace the medical advice of your physician. You should not use this information to diagnose or treat any disease without first consulting with your physician or other healthcare provider. CVMD.org, your window to the medical world. Brought to you by Arizona Heart. Produced by VAS Communications. Education. You may have endured chest pain, maybe even numbness of a limb. A variety of tests and examinations have concluded you have a blockage. Well, good news. Today's new minimally invasive techniques can help restore your diseased arteries back to health with minimal trauma. Balloon angioplasty, stenting, atherectomy, and laser angioplasty are all less invasive alternatives to invasive artery bypass surgery. These procedures are safe and require much less recovery time. The heart circulates blood throughout the human body. The coronary arteries supply oxygen-rich blood to the heart. The carotid arteries supply nutrient-rich blood to the brain. And a host of other arteries carry this liquid lifeline to all corners of the body. Sometimes, however, this blood flow is cut off or severely restricted from disease within the arteries. Atherosclerosis is a progressive disease that narrows or blocks the arteries feeding the heart, brain, limbs, and other organs of the body. It is actually built-up plaque within the artery wall. These deposits are formed from excessive fat and cholesterol in one's diet. Little or no exercise may also contribute to these accumulations, as well as smoking, diabetes, and high blood pressure. These blockages can lead to a variety of problems, including heart attack, stroke, numbness in the extremities, and even gangrene. The good news is that these minimally invasive techniques can correct these damaged vessels from within. A catheter and wire is passed into your body to the troubled artery. Usually, the insertion site is either the femoral artery in the groin or the brachial artery in the arm. Coronary procedures are done with patients awake and under local anesthesia. All other vessels are done under a light general anesthesia. Video X-ray, called fluoroscopy, helps guide the doctor to the precise location of the blockage. Once the wire is in place, a deflated balloon is passed over the wire and into position. The balloon is then inflated, flattening the plaque against the vessel wall. While inflated, expect to feel some pressure if the ballooning is taking place within the coronary arteries. If the ballooning is taking place in any other arteries, there will be no pressure. Once deflated, an angiogram is performed to determine if any more ballooning is necessary. A common problem with balloon angioplasty is restenosis. Restenosis is when the artery eventually begins to close again. One way to lessen this possibility is to follow balloon angioplasty with the placement of a stent. A stent is a small metal scaffolding device that is also delivered over a wire to the diseased area. Once in place, a balloon is used to expand the stent into a locked open position to help permanently keep the vessel from closing. Some stents are even coated with drugs that further reduce the risk of restenosis. Other minimally invasive techniques that can be used include laser angioplasty and atherectomy. Laser angioplasty introduces a laser over the wire to the narrowed artery and actually vaporizes the plaque. An atherectomy device acts as a roto-rooter and removes the plaque by cutting it out from within. All these techniques open the vessel and allow it to once again provide a healthy blood flow. These procedures usually only take a couple of hours, and normally you will only stay in the hospital 1 to 2 days. Within a week or two, you will be back at full strength. You will need to properly take care of your insertion site, take your medications, take part in light exercise, and be sure to see your doctor for follow-up visits. It is important to remember that your minimally invasive procedure was a treatment for your blood vessel disease, not a cure. You must take proactive steps to ensure a long, healthy recovery. Eat a healthy diet, exercise, control your weight, cholesterol, blood pressure, and diabetes. Reduce your stress, and most importantly, stop smoking. Angioplasty, stents, and atherectomies offer you a second chance. Seize the opportunity. Live well. A wonderful life awaits you.
More information about these programs can be found on our website, cvmd.org. Copyright 2005, VAS Communications.